Hi everyone. Today we are going to discuss about minor ailments. I'm Sasi, working as a assistant professor in College of Nursing. Objectives: at the end of the class, the students is able to explain what is minor ailments, enlist the definition of minor ailments, narrate management of minor ailments, enumerate the uses of minor ailments, discuss the treatment of minor ailments. Introduction. Managing minor ailments ensure safe and healthful environment to the patient, treat the risk injured person promptly to prevent any possible complication in case of infectious disease, take appropriate precaution to prevent the spread of infection, keep continuous watch over the patients and vital signs during the period of care, help the patient to get well soon as possible, use the opportunities of the health education during the care, always remember the limitations in providing the treatment or follow the physician instruction, help the family members in coping with the situation and prepare them for taking care of patients at home, respect the beliefs of patient in case of serious condition, refer the patient without any delay. Definition: minor ailments are generally defined as conditions that will resolve on their own and can be reasonably self-diagnosed. Minor ailments include common conditions such as fever, cough, sore throat, inflamed eyes or eyes with a discharge, earache and discharge from the ears, convulsion and fits, diarrhea, constipation, skin rashes, wounds, burns, animal bite, snake bite, scabies, fracture, heat stroke, anemia, edema, bleeding nose, shock, etc. Management of minor ailments. The first one is assessment, taking history, performing quick physical examination, and finding the cause, making the diagnosis and planning for care, providing treatment and nursing care, evaluating the care and condition of the patient. If the outcome is successful, plan for follow-up. If condition does not improve or serious signs, refer to the hospital. And we'll see the standing orders. Standing orders are directions and orders of specific nature. On the basis of this and the non-availability of doctors, nurse, health workers can provide treatment at home, hospitals or health institution, and community should be followed in temporary, basic or emergency situation. Objectives of the standing orders: to maintain the continuity of treatment of the patient, to protect the life of the patient, to resuscitate him, to create the feelings of responsibility in the members of health team. Uses: providing treatment during emergency, enhancing the quality and activity of the health services, strengthening of primary health services in the community, decentralization of health responsibilities, developing the feeling of confidence and responsibility in nursing and other health worker, protecting the general public from quacks. Types of standing orders: the authorized doctor and the registered community health nurse jointly release standing orders. That is two types. One is institutional standing orders. Standing order prepared with a view of the available resources, stock position, objectivity of the hospital. Difference will be there between government and private hospitals. And coming to the specific standing orders, prepared for the trained medical personnel, technical knowledge and special skills are required. These orders should compensate the need of a doctor. Such orders enhance the quality of community health nurse. And one more is there, that is called general standing orders. The common man is expected to follow some of the things. Example, in case of diarrhea, they can give the ORS packet. Standing orders for treatment of minor ailments. We'll see one by one in this. The first one is fever. The person is having the fever, we should examine the vital signs, gather information about other symptoms like headache, nausea, vomiting, shivering, cold, running nose, allergy, skin infection, jaundice, fits, cough, and provide rest and light meal to the patient. Prepare blood slide to examine malaria parasite and give paracetamol tab, give lots of liquids to the patient. The fever is more than 1 or 2 degree Fahrenheit, then give tepid sponge, monitor the pattern of fever and wait for 2 days. The fever is accompanied with rashes, isolate the patient. In case of delirium, convulsion, unconsciousness and hyperpyrexia accompanying the fever, refer the patient to the hospital. The next one is diarrhea. If the person is having the diarrhea, monitor the symptoms of dehydration. If the dehydration is severe or the patient is in the state of shock, refer him to hospital. Provide ORS to the patient. If the person is orally tolerable, that is rice water we can give, coconut water we can give, lemon juice, light tea, banana should be given to the patient. If there is an epidemic of diarrhea, sample should be sent for the stool test. If cholera is prevalent, immunization should be taken. Food and water should be protected. Notification should be done. People should be educated about the control of flies. Heat stroke. Person suffering should be kept in shadow and in well ventilated place. Note the vitals. Remove all clothes from the person and wrap in bed sheet. If the patient is conscious, give him cold water, mixed salt and other cold drinks. Keep continuous observation over temperature. As soon as possible, refer to the hospital. Coming to the burns, try to keep the burnt party immersed in water. Check the spread of burns. The cloth has stuck to wound. Do not try to remove it. Rings, bangles, shoes, bells and other tight-fitting articles to be removed. Do not touch blisters unnecessarily. Assess the percentage of burns. Give primary treatment of shock if needed. Give ORS if patient is conscious and not vomiting. Provide analgesics if required. Refer the patient to further treatment. Drowning. If you come across with the drowning, loosen the cloths from chest, make the person lie on his abdomen and get the water out of lungs. Resuscitate the patient immediately and send him to the healthcare center or hospital. Bites. Dog bite. Thoroughly wash the wound with soap and water. Use running water. Apply betadine or ginger iodine. If the wound is excessive, check hemorrhage. Stitches should be done only after 24 hours. Give injection TT. Do not kill the dog and observe for 10 days. Send the patient for ERV therapy. Snake bites. Make the person lie down. Do not allow to move. Find out the kind of snake. Tie tourniquet above the bite and continues to loosen if every half an hour. Make a cut of 1 centimeter length and 1.5 centimeter deep at the place of bite and try to absorb poison from the site. There should not be any wound in the mouth of the person who is sucking the poison. Clean the place with a salt solution and water or ice. Console the person and send to hospital. Scorpion bite. Remove the sting and put ice on it after thoroughly cleaning the place. Apply tourniquet above the place of the bite and remove it after half an hour. Give analgesic tablets and also the sweetened milk to drink. If patient is in shock, send to hospital. Fainting. Lie down the person, his head should be at a slight lower level than feet. The person is sitting, keep the head bended between both the legs. Person should get fresh air. Once the person gains consciousness, ask him to take deep breath and give him liquids to drink. If consciousness continue, refer to hospital. Injuries and fractures. Clean the wound with soap and water. Apply the spirit around the place of wound. Apply betadine solution and bandage the wound with a sterile solution. Monitor the condition of the patient. Treat the patient for shock. Immobilize the fractured area. Give analgesics and TT. Wound. Wash the wound with clean boiled water and antiseptic solution. Apply spirit around the wound. Remove the foreign bodies present in the wound. Bandage the wound using betadine. Give injection TT. In case the wound is large and needs sutures caused by bullet or weapon, refer to hospital. And we'll see the standing orders for MCH care. Give tablets to check vomiting and nausea in early stage of pregnancy. In case of toxemia of pregnancy, advise a restricted salt diet and complete rest. Send to hospital if there is edema and APH or PPH. The mother develop fever after delivery. Try to ascertain the cause. Give newborn in proper warmth. Initiate breastfeeding. Convulsion. Lie down the child safely on your bed. Loosen the cloths from the chest and let the fresh air come. Clean the secretion from his mouth and let the respiratory tract function properly. In case of fever, give cold sponge. Evaluate the cause. Hemorrhage. Lie down the person on back. Take BP. Press a pad on the site of bleeding. Give him liquids. Try to find out the cause of bleeding. Monitor the state of shock, and in case of bleeding or condition of shock getting out of control, send the patient for further treatment. Unconsciousness. Lie down the person in a well ventilated area. Remove dentures. Clean the secretion from mouth. Loosen the clothes from neck, chest and waist. Provide artificial respiration in case of black breathing and try to find out the reason. Sore throat. Record vitals. Inspect for white patches. If yes, it is signs and symptoms of diphtheria. Need hospitalization. Take throat swab. If pharyngitis, saline gargle is important. Give aspirin tablets and advise honey syrup with lemon juice and hot water. If history of recurrent illness, needs surgery. Cough. Find out the duration, type, color and consistency of sputum, weight loss, etc. If TB is suspected, refer to hospital for investigations. Advise rest, give aspirin tablets, give steam inhalations. Inflamed eyes or eye discharge. Bathe eyes with water and clean with a cotton swab. Apply sulfacetamide eye drops. Demonstrate cleaning and application of eye ointment. Cover with a sterile eye pad and bandage. Refer if vision diminishes. Earache and discharges. Clean the ears. Apply sulfacetamide ear wraps. Give analgesics if not coming down. Refer. If discharges is present, clean with boric acid and apply ear wraps. If signs and symptoms not subsiding, refer. Toothache. If toothache without fever, give potassium permanganate solution, mouthwash, TDS. If with a fever, aspirin, 5 grams for children and 10 grams for adult. Advice, dental care. Encourage to eat amla, orange, lemon, guava, sprouted gram, tomatoes, ragi and bajra. Ask patient to chew a clove with affected teeth. Anemia. Encourage to eat ragi. Advise dry fruits. Advise oral iron supplements. Get the stool examination for hookworms. Bleeding nose. Make the patient sit with the head erect and bend forward. Loosen all clothes at neck. Ask the patient to pinch nose at the junction of hard and soft palate. Don't let to blow the nose. Check vitals. Apply cold compress. Refer hospital. Role of community health nurse in minor ailments. She has to collect the history and do the assessment, find out the actions, complication, any specification and monitor the vitals and identifying the needs and problems. Nursing service understanding orders, implementing referral system, informing authorities in case of any outbreaks, keeping medicine kit ready, representing nurse viewpoint in meeting and being careful about limits, ensure safe and healthy environment. Conclusion. Many consultations are partly or totally spent on minor ailments. A minor elements defined as health complaint which by simple actions patients could handle themselves. More than a quarter of the observed consultation were partially or totally spent on addressing minor elements. And empowering patients to rely on self-care also for minor ailments helps to safeguard themselves. Reference, I have taken content from the www.minor-elements.com and Kamalam book also. Thank you for watching my video. Thank you once again.